Now, yesterday, a major incident was declared in the capital by the Mayor of London. That's as the rapid spread of COVID-19 threatens to overwhelm its hospitals. And with data estimating that 1 in 30 Londoners now have the virus, how is the intensive care units in the hospitals around London coping? Well, Dr. Zudin Puthacheri is a council member of the Intensive Care Society. He's also a critical care consultant, and he joins me now from central London. Good morning to you, Dr. Puthacheri. Just describe for us a little bit what it's like in intensive care units in London at the moment.
So the intensive care units they're full beyond bursting at the moment. There are more patients than we've ever had. We've had less staff than we've ever had. And it's not just the intensive care units, the hospital, the wards run by our respiratory physician colleagues, our geriatricians, everywhere is full beyond bursting. If there's a space for a patient, they're there. We've cannibalized staff from all around the hospital. Volunteers are pouring in to try and look after these patients and deliver the best care we can. Staff are breaking themselves to make this happen and to keep our patients safe. And it's not going to be enough.
Well, you're making that point. It's coming over very loud and clear. And it was said in the previous wave that people who went into intensive care had roughly a 50-50 chance of surviving. With the panoply of new treatments available, has that improved, or is that still looking the same?
Thank you. So there were 2 points to make here. At the moment, patients, if you come to intensive care with coronavirus, 7 out of 10 people will survive. So 30% of people will die. But those 70% of people will be disabled for years to come because they lose so much muscle. You lose almost 2 kilos. If I was sick with coronavirus on intensive care, I would lose about 2 kilos of muscle every day I'm on intensive care, and I'll probably be there for 2 to 3 weeks. You can see and you can think and feel how long that will affect me for literally for years.
Yeah, it's a stark reminder, isn't it? And the age of patients that are in intensive care, what is the range?
So the average age is 60. Right? 90% of our patients all were working before they came to us. They had normal lives. So the majority of patients I look after are my age. They look like me. They look like my wife. They look like my friends. They have children the same age as I do. They are young people. I'm 46. I think I'm reasonably young and fit. But these are the patients I'm looking after. And this is the same all around the country. This is what we are seeing.
And are these people who, does it include people who had no underlying health conditions?
So that's a really great statement. So I have a serious condition. I've got osteoarthritis of my knee. That's an underlying health condition. So yes, it includes people who have arthritis, maybe a broken finger. The term underlying health condition is a made-up term that is meaningless to our patients and meaningless to us. It doesn't mean anything. Everybody, there are people within Sky TV who have underlying health conditions. Okay, I want to make it very, very clear from an intensive care point of view. We treat people without prejudice, and we do the best healthcare we can to keep people's quality of life. Whether they have an underlying health condition is irrelevant.
There are some articles in the papers this morning talking about the decisions that need to be made by people running intensive care units, and they're effectively deciding who lives and who doesn't. Is that a reality in London hospitals?
Thank you. That's a really, really important question and a really, really important point. So through the first wave of the pandemic and now, the legal, moral and ethical stance of intensive care doctors has not changed. We treat people without prejudice, and our priority is the patient in front of us, okay? And we are still there. What we're talking about, and that major incident signals, is that decision-making capacity may well be taken away from the intensive care consultants and be made because of resource limitation by politicians and other people who will make that. I would say that from an intensive care point of view, we have not changed our legal, moral and ethical stance, which is to prioritise the patient in front of us.
Right. Okay. I mean, you're talking very. It's very clear talking to you that resources are absolutely stretched to the very limit. In terms of caring for these patients in intensive care, what are the biggest challenges at the moment?
The single biggest challenge is staff. We don't have enough critical care nursing staff. We don't have enough doctors. We have volunteers coming in. We have very, very senior doctors, doctors with no training, who're coming into work both as junior doctors and to support our nursing staff. It is amazing. As I said before, the level at which people are willing to break themselves to support the NHS is awe-inspiring. But it's not turning out to be enough, because you can't just magic up a critical care nurse. It takes years and years and years of training. You can't magic up a critical care consultant. It takes years and years of training. So it's going to be staff. It's not beds. It's not equipment. It's staff. That's going to be the single greatest bottleneck for us. And I don't have the solution before you ask me. I don't know what the solution is. And that really, really scares me.
Yeah, I can hear it in your voice. And Dr. Puthacheri, the front line are supposed to be in the priority group for receiving the vaccine. How many intensivists have been able to have the vaccine?
So I can't speak widely because the situation is changing rapidly. But as far as I'm aware, the frontline staff are being prioritised. Many, many intensivists are receiving their vaccine, and many of our intensive care nursing staff are receiving the vaccine.
And if there's a message for the public out there coming from you, coming from your colleagues working in hospitals, particularly in intensive care, what would it be?
I guess the message would be that I'm scared and I'm angry. And those are the two feelings that we all have. I'm scared because we're reaching a point where someone might tell us that we can't prioritize our patients above everything else, that going the extra mile for the patient in front of us is not going to be good enough. And those decisions are going to be taken away from us. And none of us have ever lived through that. None of us have ever experienced that. And we've fought long and hard against it. And that's what's coming our way. I'm scared because this is not the beginning. You heard from someone in Surrey earlier on that we're coming to the end of the pandemic. Well, every time we have a patient that comes in, actually the ramifications go on forever. It's not just the rehabilitation. It's the cancer patients who won't get their operations in the summer and the spring. The legacy of this pandemic will destroy 2021 and will continue to destroy the NHS, and that's what I'm scared about. And I'm angry, just like all the other stuff, that people are not listening. We hear today that the TfL footfall is twice that of what it was in the first wave. So we're having twice as many people out there doing things on a Saturday when they should be at home. I'm angry because we're talking about protecting the NHS, and that's clearly failed when we should be talking about protecting the healthcare of the nation. That is what's suffering right now, not the NHS. The NHS is breaking in front of us, and there's no plan to stop it breaking. We need to stop the health of the nation breaking, and that's where we've got to. That's why I'm angry, and that's why all our staff are angry.
OK, Dr. Zudin Puthacheri, really good to talk to you. Thank you for your time and for getting your message out there on Sky News.
Thank you.